Hello everyone. Today we are going to discuss about a very commonly found virus and one of the most devastating virus known to humans, and it's dengue virus. Dengue virus causes obviously dengue in humans, and it has been known for causing disease which is so much morbid and its mortality rate are quite high. So let us see how on the structure of virus, also how this virus produces various symptoms and what types of symptoms are produced, and also we'll look into the investigation part of this virus. Here's a small detail of the classification where the family that it belongs, genus, and the species. Basically, dengue virus is a RNA virus that we should know. This virus is also termed as the arbovirus because it is an arthropod-borne disease where it is transmitted into humans through a mosquito known as Aedes aegypti. It is known to cause dengue fever with or without hemorrhage, and it can also lead into a shock syndrome, which is known as dengue shock syndrome. Some abbreviations are given here. There is DF is dengue fever, DHF is dengue hemorrhagic fever, and DSS is dengue shock syndrome. Serologically, there are four types. That is dengue virus 1, 2, 3, and 4. It has been known to humans since the year 1780, and where it caused an epidemic in Asia, Africa, and North America. So, like the malaria parasite, Plasmodium, this is also spread by a mosquito. Bite of the mosquito carries this virus. Now, about its transmission, uh, it is carried, as I said, it was carried by a mosquito known as Aedes aegypti. Other Aedes species that transmit the disease include Albopictus, Polynensis, and Scutiratus. These are some other species of Aedes which carries this dengue virus. Now the target tissue where this particular virus do attack in human body. Dengue virus particularly induces cytokine production in any given cell. There are certain cytotoxic factor which affects endothelial cell in the following organs. The one which are marked bold are the primary parts of human body which gets affected, whereas the others are the less affected one. First, I will name out the one which are primarily affected: heart, liver, spleen, lymph nodes, and skin. Whereas kidney, lungs, intestine, and brain are less commonly affected. Then the mechanism, what is the mechanism through which this particular virus affects us? So when in mosquito, in this case that mosquito is Aedes aegypti, carrying dengue virus bites a person. The virus enters the skin skin together with the mosquito's saliva. And as we know, why the saliva is being secreted as an anticoagulant, it doesn't allow the blood to coagulate, and so that this mosquito can easily feed on human blood. After entering into the skin and to the blood, it binds and enters in the WBC. And it's very interesting because we know that WBCs are important to maintain our immune system. But this particular virus multiplies inside the immune cell, that is the WBC. Whereas in severe infections, virus production inside the body is greatly increased, and many more organs such as liver and bone marrow can be affected. So they are not only affecting our immune system, but also the other organs of our body. And due to its affection of the WBCs and almost throughout the body, what happens is there is a leakage of blood from the small vessels into the body cavities. So as a result, the amount of blood circulating in the blood vessels becomes low, which in turn will decrease the blood pressure. And as the volume of blood goes down and blood pressure also goes down, so the amount of blood that should reach a particular target tissue or organ will also get reduced. Adding to this, there is a dysfunction of bone marrow, which in turn causes thrombocytopenia. This is also known as reduced number of platelets. Now, we all know platelets are required for proper clotting of blood. So, as the number of platelets goes down, which creates a complication of hemorrhage associated with fever, so which is known as dengue hemorrhagic fever. Now, discussing about its clinical feature. The clinical feature occurs in two forms. The first one is the classical dengue fever, which usually affects the elder, children's, and the adults. So it's very uncommon in children's which are below 10 years of age, which is associated with fever, headache, pain in muscles and bones. Whereas the incubation period is somewhere around 5 to 8 days, skin rashes usually appears on the third or the fourth day, and it's rarely fatal. It lasts almost about 10 days. So the severity of classical dengue fever, although the symptoms are quite extreme, which is associated with pain all over the body, which is not only including your muscles, but also your bones. And the intensity of pain sometimes is so high that it is also referred as breakbone disease. Right? Like the patient feels the pain is so intense as if the bone is breaking. And also you can see the incubation period lasting around 5 to 8 days and the disease lasting only for 10 days. Whereas the other manifestation is quite severe. This type of manifestations usually occurs in children who are between the age of 5 to 10, and they are known to cause dengue hemorrhagic fever and associated or other individually present as dengue shock syndrome. On reinfection with different serotype of dengue, how does this occur? What happens in it? On reinfection with a different serotype of dengue virus, antibody formed against the first virus will react with the second serotype, that is the second virus. So there would be a complex known as virus antibody complex formed, and the symptoms of dengue fever are present along with hemorrhagic rashes, thrombocytopenia, and shock. So obviously the um, mortality rate in such type of fever where there is hemorrhage and also shock associated, the mortality rate would be quite high and the recovery rate are obviously less. Now discussing about the symptoms, breakdown fever, headache, muscle and joint pain, dehydration, is a lot of fluid is lost, nausea or emesis, that is vomiting of blood, epistaxis, that is bleeding from nose, mouth or gums, hematuria, blood in urine. So this is giving you an idea that there is some problem with the coagulation effect. That is, the coagulation of blood is not taking place. So almost all orifices of our body will emit blood. Pain behind the eye, plasma leakage, respiratory distress, there is skin rashes and purpura, there is petechiae, and there is skin rashes and purpura lesions may be seen. So overall, what we come to the conclusion that the intensity of pain is quite high. Secondly, there is hemorrhage, and as we have discussed, there could be a reduction in the amount of blood circulating, causing low blood pressure and deficiency of blood reaching the target organ. We'll later on discuss about the clinical course and the investigation in the second part of dengue virus. Thank you.